Welcome to another episode of What Rubbish, Holistic Treatment to Breast Cancer with Alka Ohri Foundation. We're excited and delighted to be here with wonderful people over here, wonderful audience today that is going to talk about exercise, nutrition, and physical ability, how they can perform and get a better, healthy living during the course of their treatment. Thank you for joining. Today we have a special episode today. We're going to get into more depth about diet, nutrition, and exercise, which are the key components of healthy living, in my opinion. And today we have Nancy, and we have Mike, and we have Christina. And I'm going to have them open up with their own introduction as to what they specialize in and what their functionality as well as what their purpose is at the Zakim Center. And we are at Dana-Farber today, and one of the partners of our foundation that we're excited to build together. So Nancy, why don't you kick it off?
Excellent. All right. Hello, everyone. My name is Nancy Campbell. I am the exercise physiologist at the Zakim Center at Dana-Farber in Boston. So I have been here for 20 years, which is hard to believe, working alongside Dr. Ligabell, who you probably have heard in a previous episode. I've been very fortunate to work with Dr. Ligabell on probably at this point at least 15 different research studies looking at the benefits of exercise and nutrition for cancer survivors. I also teach some exercise classes for cancer patients, and I also am part of the Healthy Living program that we'll hear more about today.
Oh, welcome. Yeah, we'll talk more about that, yes.
I'm Michael Carrier. I'm a physical therapist, but I am the program manager of health and wellness here at the Zakim Center at Dana-Farber. I just got the chance to join the team just 4 months ago.
Oh, congratulations.
Yeah, thank you.
Yeah,
it's been great so far getting to join these two great professionals and Dr. Ligabell. And really my main goal since I've been here is working with Nancy and Christina and Dr. Ligabell and building out our new individualized healthy living program.
Okay, good. Christina?
Great. Hi, everyone. My name is Christina Conti. I'm a registered dietitian nutritionist, and I have a specialty in oncology nutrition. And here at the Zakim Center, I actually have two roles. I work both as the nutrition coordinator and as a health coach. So I provide programming to our patients in our nutrition role, including classes and presentations. And then as a health coach, I'm here to support patients one-on-one with their physical activity and overall wellness goals.
Oh, nice. Well, welcome. And I appreciate the fact that you guys took out some time to do this podcast with me. We appreciate it. I think the purpose today is to kind of dive deep more into how you are providing benefit to the women who are have a breast cancer. And I think maybe it might be a good idea to kind of have a conversation between us as to what knowledge, currently what you guys are doing in the program, how are you helping these women from your perspective in your specific category to have them a better living while they're going through this dangerous disease. So maybe anyone can start. So maybe Mike, we can start with you.
Sure, I can kick it off, and I'm gonna steal one of your quotes from I think on a previous one of your podcasts or interviews that where you mentioned that there is a better way for these women,
right?
And that women afflicted with breast cancer can live happily and with less suffering.
That is so true, yes.
And I really think that's really the big mission is to try and support your vision for that. And so what we've tried to develop is a more individualized approach for these patients. It can be very consuming to get a cancer diagnosis, losing a sense of control. Let alone adopting healthy lifestyle behaviors like Jennifer alluded to. Sometimes these patients get a little tunnel vision.
Right.
And so really the goal of our program is to have an individualized approach to meet patients where they're at, help support them in behavior change and adopting healthier lifestyles, healthier behaviors.
Right. And I think, I was talking earlier also that exercise has shown a significant benefit to the overall well-being of women with breast cancer. In fact, some cases, it has reduced the tumor or even reverted the case of cancer in their system. Can you shed some light as to how are you managing the exercise program in the research, and what are the guiding principles that you are adapting to help these women?
Yes, so our exercise classes are wonderful because we can take women in, no matter where they are on their cancer journey, Are they newly diagnosed? I see lots of women who have gotten their diagnosis and literally their next phone call is to get into exercise, meet with a nutritionist, find out about meditation, get a massage. Like, we have a lot of very motivated women that come to us and, from the get-go have read the research. They've said, okay, I read that I'm supposed to get 150 minutes a week of walking. I know I need to be doing strength training, but I'm going to have a mastectomy. I'm not going to be able to do upper body for however many weeks. What can I do during that period of time? What can I do? My surgery's not for another month. What can I do now? What sorts of things? How can I prepare my body for the surgery that is coming?
And I think that's where the exercise really plays an important role. So can you walk us through when the women comes to you? What are the initial things that you are doing in coaching them?
Yep. So when they join our Healthy Living program, we are doing a battery of assessments to see how are they doing? How is their balance? Is that, have they maybe been through some chemotherapy? Maybe there's a little bit of numbness and tingling. So we're looking at balance. We're looking at strength. We're looking, upper body strength. A lot of times some of that can get lost after treatment. Looking at lower body strength, looking at their endurance, and then, sort of tailoring the exercise based on what we find in this assessment. Okay, we want to, focus on these particular pieces of an exercise.
Do you also face the mood swings with women? Because there's a lot of psychological impact also, and now we are trying to help them change their lifestyle. How are you managing that? Because their mindset is very important, in my opinion, and I think that mindset is kind of a fear of dying because of the nature of the disease itself. Will I live longer? And the emotional aspect of that, how are you helping them with that?
Right, a lot of focus on some self-compassion for sure through this process. I will meet a lot of women that, can be quite hard on themselves. They're in the middle of going through chemotherapy and trying to work full-time and, take care of the family. And then, they're upset that they can't get their 150 minutes a week of exercise. So I'm working with them. Okay, what amount can you do? How can we, this concept of exercise snacks, where can we get little bouts of exercise in your day to help you reach these goals? And, but being a bit kinder to yourself when you're going through this journey that, some things can't do everything.
Yeah,
and
absolutely.
that, having some time for some self-care, that's not, that is important too.
Right. So I think you mentioned one of the things you remind me of about the nutrition when you mentioned the word snack. And I think nutrition plays a very important role. And I think, Christina, you are one-on-one with these women, guiding them, helping them. Could you talk about some of the things that you are working on in the program?
Yes, absolutely. So I work in sort of two roles, as you know, at the Zakim Center. So as far as the nutrition piece goes, we have a number of programs in which I can support patients, and I think that's really the key term here, looking at where people are right now and helping them to set goals that are realistic for them. So that really transcends everything we're doing here, thinking about where they are now and how we can help them to build on their healthy lifestyle. So we offer classes, that's one option. They're group programs, but they're small groups, so patients really have the opportunity to converse with me and their peers and learn more specifically about how they can create a more balanced diet for themselves.
No, you mentioned good points over there. I think now, looking at the audience that are going to listen to this podcast, they want to pick up some of more substantial, more substance in terms of what are the specific things that I should be doing as a patient. What are some of the guiding tools that you can tell them through this podcast that they can pick up and then they can follow at least? Maybe one or two things that maybe either one of can kick it off.
Sure. Yes, I'd be happy to kick it off. So one kind of approach that we recommend to all patients in the nutrition programming, and that certainly blends into our healthy living too, is thinking about balance within our diet.
Right.
And that's a really kind of simple tool that we kind of outline. There's something called the plate method, where a patient can visualize essentially a dinner plate, like a 9-inch plate, and kind of fraction that off into one half of that plate being low starch vegetables, quarter being a protein that's low in fat, and a quarter being a starch, ideally with more fiber. So kind of following that formula inherently creates this balance, exposes us to vitamins, minerals, fiber.
So Christina, sorry to interrupt, but
Sure.
here's a challenge that we faced. When my wife was going through the treatment, we were asked to meet a nutritionist. That there was only one nutritionist in the entire center that we went to, and basically she gave us a PDF printed document from the site, but that was not really, understanding the women is going through a lot more things. They want to be told this is what you should have based on your lifestyle and all that stuff. How are you managing that piece? Because I think women want to know specifically, what should I not focus on? What should I focus on? You mentioned about the formula, not to be critical about it, but women won't remember that. So how do you guide them and educate them? What would you advise them through this podcast that they can say, okay, I learned something from Christina today. I should not be doing this. I should be doing this. What would that be?
I mean, that's a really great question. And I think the issue is that we don't know any particular food that can prevent cancer or recurrence. So it is so much more about the lifestyle patterns that we're following. And I think that's, where our whole program comes through.
Okay.
We know that really like an emphasis on plant forward diets is really important. And again, I know it's not specific, but it's more about what are we consuming more frequently.
I mean, that's very good. Plant-based diet, I think it's very good. And one of the things that was quite emphasized was protein intake. We should have more protein. Can one of you talk about that, protein intake?
Sure. I don't know, if, Nancy, if you want to speak to it in regards to exercise, but
no, overall,
certainly.
Nothing is. I know one thing for sure, that all these components, there is no one magic pill. It's a combination, right? And everything has to work in conjunction with each other in order to make it work. So I think the protein part, it depends upon, like, for example, we were told, make sure your protein has no added sugar, and you should have the protein which has less sugar or less than 2 grams or 3 grams. And then they recommended a protein shake for us. So I was talking in that context. So what would be the recommendation that you would make to the patient? Should they take protein? And if they do, how much protein they should take?
Sure. So that, I think, to your point, everyone's going to be a little bit different based on their needs, where they are in their treatment and their diagnosis. But I think you brought up good points thinking about what else are we taking in with the protein. So if someone's taking like a protein supplement, as a dietitian, generally we recommend, how much can we get in from whole food sources? But we know that realistically, sometimes our appetite, especially in this patient population, can be depressed, and maybe sipping on our, protein in the form of a shake could be just more accessible. But I'd say in general with protein, thinking about, what sorts are we choosing, especially if we're looking at the breast cancer patient population, and just anyone with heart, health considerations. We really want to focus on leaner proteins. So really thinking more about our plant-based proteins, thinking about beans, nuts, seeds, fish, getting those healthy omega-3 fatty acids from fatty fish.
Is there a particular type of fish that you recommend? That's a question that comes up.
Yeah.
Don't eat this, don't eat that.
Yeah. I mean, I think in general, fish is a great option. We want to think about how it's prepared, how much oil or additional fat is being used with it. But I think generally it's great to incorporate some of the oily fish into our diet, like salmon, sardines is another great source too, thinking where we can get those omega-3 fatty acids in.
Okay. And How about you, Mike?
Yeah, I want to throw something else into this equation too. And you're talking about how does our program help these women, right?
Yeah.
There's a lot of information, pamphlets, handouts that can be given by experts in the field, nutrition, physicians. But how is it practical for these patients to integrate it within their own lives, right? So I think that's the big difference between what we're trying to do and what is typically done, I think, just in medicine in general, where we have this expert approach of, we know all the research, here's all the information, take it and do with it what you will. But
exactly, that's a concern to me.
Behavior change really only happens if it's sparked from within the individual.
Right.
And so we try to use this coach approach. You know, we have this acronym of being curious and learning about the patient in front of you, being open-minded, appreciating that all of their efforts, having compassion, and also being honest with them. But if they're really going to look for behavior change and lasting behavior change, that has to come from within them. And so really our goal of coaches is to try to find these little pearls, excuse me, that they can call upon strengths and leverage strengths within themselves, where these are ideas and words coming from them. If we can do that, whether it be through nutrition changes or exercise, they're more likely to make change.
Mike, you mentioned a very important point. I just want to harp on one thing about the coach factor, and this was some of the big concern that I had when my wife was Alka was going through the treatment. You know, and we talked about what I saw was, you know, she can only listen to so much to her husband, you know, like me. But if you came in the picture, she would more than likely listen to you because you're the expert. And my recommendation to the audiences who's listening to this podcast is that reach out to the right sources, and because the help is available. But the unfortunate thing is they don't know where to go. And I think you bring up a good point, because that's the one-on-one coaching is so important for these women. It is really helpful. I mean, what are your thoughts about exercise? Same thing, challenges. You know, how do you encourage them to do that exercise that they're supposed to?
I think sometimes giving them, you know, some of the knowledge. I mean, we all know that we need to be exercising and eating healthy, those things. Right. But when you can give them more sort of concrete data that, you know, the Nurses' Health Study found that women who exercised and walked 150 minutes a week reduced their risk of recurrence by 54%. You know, when you can kind of give people, so, you know, everybody's motivated differently, but for many people, when they can have this statistic, or even back to the protein piece, when they, you know, they've been given a handout that they need to eat more protein, but why? Like, what's the reason? When you say, well, you know, it's important because, you know, you're potentially going to be losing muscle mass, and your muscle mass is important, you know, for your longevity. And so sometimes kind of giving them, you know, some more knowledge and understanding of kind of why you need to be eating protein and why the vegetables are important, and then getting creative with how do you incorporate those particular foods. Or
I like what you said. I think that makes a lot more sense for women to really know the reasons, because once they know the reason, I think they'll be more motivated to follow your instructions, because now you give them something to shoot for. Because right away when they hear the word cancer, they start thinking, oh, am I going to live? How long am I going to live? So we want to divert their attention towards better living and giving them hope. And I think that's very important. What I think some of these institutions, we need to shy away from a standard process. It has to be customized to the individual needs, rather than giving a standard form. This is what you go, do this. So I think I like what you said. That's where the coaching part becomes really very essential. You know, so what are some of the challenges that you guys see in course of your coaching to these women, and how are you trying to overcome those challenges?
I think I can start just kind of, sure. I think what can be difficult is, you know, thinking back to how they used to do certain things, whether it's how they used to cook, how they used to exercise, and kind of helping them problem solve and think about, okay, well, you know, this has changed, or maybe your energy is more depleted. maybe, your ability, your endurance isn't there, kind of helping them to meet them where they are. And I think just reminding them we have these long-term goals that we're working towards, but really helping them to set short-term goals that feel within reach to help build on their self-efficacy so that they have the confidence to keep going. I think that, is a challenge, but one that we're prepared for, and meeting them where they are and supporting them and reminding them, constantly of the progress they've made and what their goals are, to your point.
And
to
when they
stay
see the
motivated.
progress that they're making, they get more motivated to do that.
Absolutely.
So you have to go through this emotional imbalance.
Part of the process.
Part of the process, right? Whether it's going to work, it's not going to work. Am I doing the right thing? These emotions are going through their mind. So it's interesting that you say that, that success is always motivating.
Big psychological component to all of this, right? But the more we have these touch points and the more motivated we can get them, it gives them a little bit more personal control, maybe in a setting where they've lost some control.
Right.
Right.
And to trust their body again. Their body doesn't look the
Very
same
good
anymore.
point.
It
Very
doesn't
good point.
feel-
Yeah,
so-
trust their body. And I think this is where I feel the meditation and yoga part can play a very important role, because the emotional imbalance can become balanced when they see within themselves, and they have that hope of living better. So I've seen, I do yoga and meditation myself, and I think that really helped me through the process that my wife was going through. And when she and me, we did that, there was a moment where she was almost good. And there was a period that she really was basically almost clean with almost no cancer. And but it triggered back again. But anyway, that's really important what you mentioned, Nancy. Looking at the profiles of people that we talked about the emotional balance, we talked about nutrition part, with the fiber diet, with the protein intake. I mean, there's so many options that are out there. It's quite confusing. How do you help these women from that position of not being confused, but knowing what they need?
Yeah, I think from my perspective too, just having an open dialogue and allowing patients to ask questions, then that allows me to then provide actually what the research, what the evidence says, because there are unfortunately a lot of misconceptions out there. If you think about that, for example, like women need to completely avoid sugar, or, any cancer patient. So I think it's great to just kind of foster an environment where a patient feels comfortable sharing their concerns, and then coming at it from a place of, again, providing evidence and letting them know, though this is common, this is actually what the research and evidence says about these points.
I'm going to talk a little bit controversial. We live in a clinical space environment, and everything is about data. Everything is about the studies that are doing. I come from a pharmaceutical background, so I can appreciate how the R&D has really significantly helped, come a long way. A lot of changes have happened. But at the same time, even though we are driven by the data from the clinical outcomes and all that stuff, but there's also a personal element to it, where how do you balance that piece, if you know what I'm saying? How do you guys balance that piece? Because one is the clinical data that is showing you. One is the personal piece that is right in front of you. And you are also doing your own clinical judgment based on the profile, number of patients that you guys are seeing and working with. And you create a statistical analysis out of that. How is that influencing you guys? Or does that influence you in terms of your daily practice?
I think when it comes to coaching, and to what all of us have said, is trying to meet that patient where they're at and trying to make sure that whatever recommendation that we're giving is going to fit within their lifestyle, and is going to be easily, relatively easily implemented for them.
So as
it relates to, whether it be nutrition or exercise, we certainly we have expert opinions here with a lot of data to support it. And with any research, it's a bell curve. You always have outliers on either side. Right? So
of course.
not one specific thing is going to work for every single person, right? So it's, well, we're trying to combine an evidence-based approach and what we know, but then working with an evidence-based approach to lifestyle and behavioral change and integrating those things. But doing this individualized health coaching program, it's working with that person to make sure that we can take that and fit it in a way that's going to work for their lifestyle.
So when it comes to these patients, what are the kind of questions that they ask you when you are coaching them? I think that would be kind of interesting to hear that out.
They get a lot of questions from us before we even see them as well. So, part of
that would be good to know. Yeah,
I can give a little information about our screening process, and the reason why we implemented it, and one of the tools that we're trying out, is to make sure that these patients land in an environment that's going to be safe for them to participate in physical activity and exercise and be most effective for them. So they're getting surveys that are going to screen out for major things that might warrant maybe more formal rehabilitation, like Dr. Ligabel was talking about, whether it's rehab or physical therapy or occupational therapy. Mm-hmm. If they are a little bit more medically complex and might need more clinical supervision with exercise, they would probably see Nancy. And then there will be some people that just need the general advisement and then that support and coaching, maybe a little nutrition work, general nutrition work with Christina. So they get a lot of questions from us up front. And we are looking at things like anxiety and depression measures as well. So
I think that's a bigger one, right?
Yeah, so that way we're aware of it as coaches beforehand. They're validated measures, and we have a lot of resources available within the Zakim Center. So if it's someone that has mobility and anxiety and depression issues, we're kind of stewards of our other programs, and yoga may be very beneficial for these people.
So are you guys, you just triggered another question in my head. Let's say when a woman with breast cancer walks into Dana-Farber Cancer Institute, are you only involved with the Zakim Center, or you're also pulled in from the Dana-Farber, these women who are coming into the Cancer Institute right from the get-go?
So
when they see the medical oncologist, for example.
It's just within the Zakim Center currently.
Okay, so are we doing anything about creating awareness on the Dana-Farber side where, these resources are available and we can tap into those resources?
The plan is to get there. And like Dr. Ligabel had mentioned, we've already had a couple of other departments that have reached out to us about our programming and want to champion it and get more involved and work together to develop.
So hopefully through this podcast, we should be able to kind of encourage a lot of women that there's an integrative oncology group that is at all these major cancer institutions, that they should look into it. Because I think that's very important, because if that is a hidden piece and it's not being shared by the women, I think that's not misinformation, but I think it's kind of a disservice to women. They ought to know what are the available resources for them. And you mentioned that Dana-Farber has a good amount of resources available, so I think we need to capitalize on that more and more. How do you see the future of what you guys are doing? How do you see this as evolving more and more? Because people know that exercise is very important. Do they do it or they don't do it? I think more and more women are getting involved into exercise who don't have cancer, which is a good thing. Physical ability to perform, I think it becomes much more critical because the bones get affected by the chemo and all that stuff. So balance becomes an important factor. You are what you eat, and I'm sure you use that phrase. So that is also very important. So how do you see this whole concept of nutrition, exercise, and physical element playing an important role moving as we go forward? Where do you see this evolving now?
I guess I'd say personally, our goal for these patients that are enrolled in our healthy living programs, and specifically the health coaching, is that we are there to foster these habits and support them in building on their physical activity and having this balanced approach with their nutrition, and that the hope is they'll be able to sustain those habits on their own in the future. So I think, I see it as we're really setting them up for success.
Success, yeah.
We have these multiple touch points.
But you're doing another thing also. You're doing the cooking webinars too. Talk about that a little bit.
Sure. Yes. So I also offer, as you mentioned and was brought up earlier, a few group programs. So I do a cooking webinar once a month, and the focus of that each month is a different plant-forward recipe. Usually has some ties to the Mediterranean style of eating, and it's something that we can do within an hour. The recipe is sent out in advance to the patient. So the idea being,
who's your audience, by the way?
Oh yeah, sure. So it's anyone who's a Dana-Farber patient is welcome to join. And this is always advertised in our Zakim newsletters that we send out as well. So they are patients who have at some point been seen at Dana-Farber, and they join on Zoom if they want to cook.
Really?
They can. Most people are there, I think, to learn about the ingredients, the health benefits, and to have that community. We have a lot of course, we always are excited and welcome new patients to our program, but it has been something that we've had a lot of regular attendance in as well. Okay,
so you have had quite a bit of success in terms of, have you had any feedback from women who attended your webinar?
Yeah, we have. So they seem to enjoy if they have ideas for, types of recipes or even, ingredients. We definitely welcome feedback if there's a certain food that they'd like to see cooked or something like that. We try to think how we can incorporate that too.
How about yourself and Michael?
Right. I mean, to piggyback off of Christina, with the classes that we offer, anybody is able to take those. And then there isn't a time limit with them either. So being at Dana-Farber as long as I've been here, I am fortunate enough to have participants in my class that have been with me for 10 years or 12 years, and they kind of keep coming back because of this community
and you've seen the progression of their health is getting better and better, right?
Yep. And if there's a recurrence, we, see them through that and the ebbs and flows of. So the newly diagnosed participants get to see the people that are a little bit further along, and see them doing well. And so it's just a very welcoming, encouraging, come as you are, do what you can environment that they may not be able to find sort of in their community. Where they might, be going to a yoga class and having to modify everything. Juliana, who's our wonderful yoga instructor, is, going to be offering up all those modifications. If you've had a mastectomy and you can't do downward dog, here's what you can do instead. So I think women really appreciate having that expertise in the room so that they can, still keep exercising but feel good after and not leave.
There you go. That's good. That's wonderful. I think that's very encouraging. How about you, Mike?
I think you hit on it with Dr. Ligabelt when you two were talking, and I think the big picture, right, is having healthy living become the standard of care in oncology. And, there's hurdles because we're talking about institutional procedures and making it part of the workflow of physicians, and specific to exercise and even rehabilitation. It's a staggeringly low percentage of patients that are referred for any sort of rehabilitation or exercise therapy. And so whatever the barrier that may be.
So healthy living is the way to go, right?
Healthy living is the way to go.
Thank you, Christina, Mike, and Nancy for joining us today. I think this was a very productive conversation that we had, focusing on the plant-based nutrition diet, talking about the physical ability to perform in order to balance yourself, and having a coach in terms of guiding towards your healthy living. And then Nancy, you touched base about exercise, yoga, and meditation, which I think is important. These are the holistic approaches that there's no one key to success. I think it's a combination. And through Alka Ohri Foundation, we are bringing this awareness to women out there. So thank you very much for joining, and hope to see you guys at the next episode.